Good morning, everybody. Thanks so much, Kurt. It's been a pleasure to serve and work with Kurt and the rest of the folks at Southern Eye. I am a retina specialist in town. I've been in town for a while, but been with Southern Eye for the last 3 years. I'm up here today to talk about missions, and specifically for myself, mid-career missions. We'll talk about that, but we talk about goers and senders. Both have a role in serving our world. And so I don't want to discount senders. They're very, very important. It's very expensive to go do some of these things overseas. But we're going to focus on going and how my heart's been bent that way, my wife and my family, and maybe how your heart may be bent that way as well. What is mid-career missions? The analogy came to me this morning as I was driving here. I never come to the Hyatt Regency on Main Street. I go other places in town, so I'm sipping my coffee, listening to Tim Keller and thinking about fly fishing and realizing all of a sudden I need to get from the right lane to the left lane to come downtown. And that's kind of what mid-career missions is. You're going along a normal career path, and suddenly you feel the need and understand the call to do something different. Why would you do something different? Why would you leave a practice, possibly a partnership position, and move overseas where the pay is slightly less than what you're getting at the moment? There's challenges, there's heat and no air conditioning. That's a question I've thought about frequently, prayed about, maybe thought about it at nighttime when I should otherwise be sleeping. But try to put some different thoughts down on paper to share with you guys and separate those out into some different categories. So we're first just going to talk about my story a little bit. I've learned a lot from other people's stories, particularly through COS over the years, so I'll share a little bit of mine. As Kurt mentioned, I am a second-generation ophthalmologist, so you might say I was born to be an ophthalmologist, as my dad packed me with his suitcase to an academy meeting at an early age. I grew up understanding the profession from the kitchen table, as well as serving as a college student in his office. That was a lot of fun. I enjoyed that. I also had the life experience as I was going off to college and thinking about my own career of hearing about my dad, who had rubbed shoulders with Jerry Shields, and his career and training, gone, taken the bull by the horns and learned phaco through his career in live private practice. But then had to have a shoulder surgery and another shoulder surgery and a third rotator cuff surgery, and realized that his career experience was quickly coming to an end. That life experience taught me that a career is big, it's important, we put a lot of time and energy into it, but it is fleeting. How are we using our career today to serve our Lord? I had a wonderful experience. Fast forward a few years after college to our training. Several UAB grads here, thumbs up for that. I got to know Dr. Luke White. He was a wonderful mentor to me. He taught me how to pray with patients before going into a surgery. He taught me how to view patient care as a ministry, as a spiritual experience. Let me peel my first macula, which was just exciting for both of us. And he started a fellowship program. So he was a little bit of a Lone Ranger coming back to Birmingham that already had, the old school guys taking care of all the retina in town. And thank you for following along the slides. I'm talking, not clicking, but started a fellowship program kind of from an early age, got a great group of partners there. Unexpectedly, during my first year of fellowship, Dr. White passed away. Sorry, some of that's emotional, but kind of shook our community there, and firsthand experience of wide open guy doing great things, whose life was cut short. And how do you view that for yourself? You may have plans, you may have thoughts about what you're going to do in the future, but what are we doing today with the time that we've been given? Some of that's brought home scripturally through Ephesians 5. Make the most of every opportunity. Seek out what the Lord's will is for you today. From Luke 12, are we focusing on building bigger barns for ourselves? Are we aware that this very night, perhaps, our life may be required of us? What are we doing with the here and now? I've had some other life experiences. We can fast forward to the rest of the story for Dad. He had to move on. In his career, he got to participate in residency education, so not operating, but teaching. Rubbed shoulders with Dr. Chris Bergstrom as he was coming along in Emory, which was awesome. So some fruit from that experience. But he also got to know the American Leprosy Mission, which is headquartered in Greenville. It's an international organization, but was able to sit on the board, get to know Margaret Brand personally, and have some mission experience himself, which he had not planned on. I got to hear about that and experience that through his eyes. Coincidentally, I didn't know who John Cropsey was, but I got to meet his dad on the field in Togo. Great general surgeon, missionary, experienced his life firsthand on the field. Crossing paths with the Hensons. And then some fruit from Dr. White's fellowship. I wasn't the first fellow. There were fellows that had gone before me and completed their training. And so we ran across this guy named Dr. Ben Roberts, who was just bent on finishing his training and getting on a plane and moving to Kenya. And that was kind of a fascinating idea to me. My family and I became supporters of him just financially and coming to know what he was doing with his life. But we came to realize that Ben was always needing financial support, but there was the lack of boots on the ground. So occasionally Ben would come home or go to meetings or otherwise, and he may really benefit from having some people that were interested in serving him more directly. So in March of 2017, several years into practice, my wife and I and our 4 kids packed up our own trunks and jumped on a plane to head over to Kenya. We weren't the best first-time visitors. My wife, who's also an active pediatrician, had the flu at the time. We didn't know what we were doing, really. We weren't the best of help to Ben, but he was a tour guide for us to show us around, introduce us to people. Got to visit an orphanage close by with the kids. And it's just a powerful experience for us. And just allowed us to start making headways of how do you get groceries, how do you keep your kids healthy and wash the fruit and put up mosquito nets, and get to know people in the hospital, the processes there, so that we could go back again and again and eventually be, in a sense, self-sufficient or be able to serve in Ben's absence as the active retina physician over there and really make it a family ministry where our kids can come up to the office, come up to the clinic or the OR space, some of the rural ministries as well. And, you know, whereas Ben was jumping on a plane right after training, we might have been on a slow boat toward missions or maybe walking step by step where each step was revealed to us one at a time. So a different pathway to moving into the missionary world. That's been our experience to date, and I guess the point being we're heading over there again in just a few weeks to spend a school year as a family, so we're stepping out of active practice and going to serve. That's where we are. So we've had some life experiences along the way. The results of those life experiences that we have come to know and understand the need for healthcare providers in third world countries. And I think as you have that experience yourself personally and see the needs, you just come home with a different math problem in your head, an accounting of your time and your resources and what your day-to-day life is meant to be. So is it real? Is there really a need? How bad is it? And how can you interact with it personally? Recent PACS graduate, if you haven't heard of PACS, go look it up. But a recent PACS graduate in pediatric surgery just was doing his own math problem as he was coming back to Sierra Leone and understanding that he is the only provider for the pediatric population in his country, perhaps 4 million kids there. Does that translate to ophthalmology? Well, it does, and we have maybe an attempt at the numbers. There's an article published from the British Journal of Ophthalmology in 2020 trying to compound those numbers and look at those things. For the states, we have about 55 providers per million people on average. Trying to do the mental math, that's about right for the upstate, maybe 50 per million. People are getting good routine maintenance care as well as all the surgeries getting done. Maybe we're too busy at times, but the work is getting done. There are countries, mainly in Africa, but other places where you're looking at 1 per million, 2 per million. That's a lot of patients to take care for as an individual provider. There's not as many numbers out there just to look at in terms of subspecialty care. I'm a retina provider. What does that look like for me? In our upstate area, we may have 8 or 9 per million. I would say most retina docs around here would say they're fairly busy. You can just flip those numbers for the hospital where we're going. There's 1 provider for 8 or 9 million in this area of Western Kenya. Keep in mind, Kenya is a fairly well-resourced country. You go further out to Uganda or Tanzania, there's less people. So you serve out to those borders and beyond when you're in western rural Kenya. So if we understand that need, what do we do about it? Well, we can be grateful, certainly, for where we are. We can be aware of what the needs are, to intentionally be aware of what the needs are, and be willing to ask some questions about how you can interact with the need. You have things to offer. Hopefully not like this fella who's offering salmonella on a stick, as our infectious disease providers would say. But you have something to offer. It may be pending your current status in life, your current season in life. So not everyone can jump on a plane and go. But think about it. Think about, do you know what the needs are? Do you know who is serving where? Are you just asking those questions and inserting yourself into that space where the arrow may someday point to you as the one who needs to go? If you own a practice, have you interacted with missionaries? Have you ever provided a job to a missionary or answered questions like, what happens when I leave? Oh, that's right. Southern Eye has done that before. Thank you guys for being willing to step into that space and say, we don't know what we're doing, but let's pray about it. Let's see what God is doing. Let's see if he'll bring a provider to step into your place when you leave. And he's done that beyond my expectations. Are you a goer? Are you a sender? How do you know? I don't know if you can completely answer that question until you go. We'll just throw that out there. Senders are needed. It's expensive, but it's not exclusive. You may be both. Be aware that there are people in this room and in this hallway here who have connections with every single country out there in terms of going. So there may be an easier path than others. You don't have to go find a place for yourself. You can find a friend. You can find an organization. And let me take the pressure off as well. You don't have to fix every eyeball you see when you go. You may be figuring out how to wash the fruit and put up your mosquito net the first time you go, but it'll be an entry point, and God will speak to you as you're there. Is this something for me? Is this something that he wants me to participate in? I'm supposed to cover some of the skills needed to go. This one's easy. If you're trained to be an ophthalmologist, you have the skills needed to go. You can teach, you can diagnose. If it gets around to treatment, that's great. But build upon your first experiences. You don't have to conquer the world the first time around, but you can learn the skills as you're there. And you can get bigger and bigger. Don't limit yourself either. Somebody in this room has helped to build an eye department with U.S. aid, millions of dollars. Somehow that all happened out on the field. We're hopeful to start and encourage a fellowship program for retina. We'll throw this out there. Did you know until this last year that if you wanted to become a retina surgeon in Africa, you had to leave Africa? It wasn't a fellowship program. It's a work in progress in Kenya. So we understand the need. We have life experiences, but maybe we need a little bit more. If God is who he says he is, the creator of our world, if he can make a bird, there you go, Jono. What's that? Sunbird, glitters in the sun. He makes another sunbird. Oh, let me get there. I'm sorry, I'm ahead of you. I'm leaving people in the dust. There you go. You know that one. If he can make another sunbird, if he can make all sorts of birds that are beautiful to look at, if he can make our eyeball that can see these amazing sunbirds, that takes everybody in this room to try to understand and fix and correct. If he's that amazing, if he's the God of all time and all space, maybe we should at least listen to what he has to say in his word and scripture. Perhaps Psalm 39 speaks to what we've already mentioned, the fleeting nature of our life. Matthew 16 talks about how we must deny ourselves and take up our cross. It's a very un-American idea. It's the American dream to deny ourselves. James 1 expects us to look after orphans and widows. We're expected to be open-handed with the poor and needy. If we simply tell people to go in peace when we see their needs, but we don't help, if we don't practically give them what they need, what good is that? I'll make the case that the God of the Bible, of Christianity, calls us to care for these people, for the orphans, for the widows, for the poor and the needy, for the least of these. And I'll say also specifically as a Christian provider that we are called to do that. So if we're here, if we're there, wherever we are working, wherever our community is, that we are called to care for the poor and needy, to find a way to do that. We may be in a situation that doesn't do that. We may be the voice for the poor and the needy. We may need to change some things about where we are, what we're doing, so that we are enabled to do that. I think what may make the most difference between whether we're serving here or there is how we look at the parable of the Good Samaritan. When we're called to love the Lord our God with our heart and soul and strength and mind, but also to love our neighbor as ourself. Who is our neighbor? Who is our neighbor? How big is our neighborhood? Where is our neighbor? I think God speaks to us in our heart about that, and I think that first time that you go, He may answer some of those questions for you. So we have scriptural direction. We also just have that personal experience with God, with who God is. How He has loved us affects how we love others, how we can care for others, how we can hand out, practice mercy and compassion and grace. As the blind man in John 9 just feels compelled to relate his own personal experience. I don't know really who Jesus is, but He healed me. I was blind and now I can see. God has loved me. He has forgiven even me. He has provided for me. He's given me a life and a wife and a wonderful family and education and training. What do I do for that? I think that's truly the intangible of missions, is what has God done for me and how can I respond to that? And that leads to decisions that defy reason, that are not prudent or orderly. They call us to ask questions and move in directions that He leads us. And so we ask questions like, what changes in our life when Jesus has given us everything? When He's provided everything? How do we respond to that? How do we leverage just what we have? Our training, our practice. And let me just say for practice, I'm going to veer off for just a second because I skipped it earlier. I mentioned Southern Eye. What a blessing it is to work in a Christian practice. There's some younger docs here and listening. You'll have choices of where you live and where you work. But when you start veering off the path career-wise, when you start asking these questions, what a blessing it is to sit down with folks who say, "Let's pray about that. Let's think about what God might do. What doors might He open?" You can be well used in many practices, in academics and practices that aren't focused on the same things that you are. But what a blessing it is to think about things. And if you're looking at practices, not every practice is out there. Not everybody in the world can work at a Christian practice. But talk to somebody who's in one. Talk to Kurt, Brad. Talk to Max, Sue. Yeah. Talk to, yeah. So Stan Pletcher back there. The many practices that can give you the ins and outs of what that means. But have we considered how our practice can interact with missions? How can we leverage our life for Christ? You may be thinking, well, that's probably not for me. I have too much going on. I've got kids. I've got debts. I have a mortgage. I'm not the best guy in the world. Why would God send me? I'm not one of those missionary folks. Yep, that's me too. Me too. He can use me. He can use you. He can use all of us. There's many objections we might have to becoming a missionary. Just bring all those to God. Let him answer those questions as you move along. Wrestle with those things. I've wrestled with them as well. But be willing to step in that space, or be willing to be willing. That's kind of a unique phrase, but some of us have such, and I would say myself as well, just, we can put up a barrier to an idea and just never step into that space when you're asking the question. Be willing to be willing. There are people who need your help, who need help in general, and who also need the gospel. Missions, ultimately, we're helping a physical need, a tangible need, but we're doing it out of the name of Christ and his love and what he's done for us. If you're thinking about missions, you may find yourself in a lonely spot. You may think it's wonderful and exciting and everybody should be in your same place, but not always. Sometimes you're the only one thinking about those things. Be bold and confident that God can call you to that, even if nobody else is. There will be obstacles in the way. Expect those. Timing, schedules, cost. But don't be deterred. COS is a wonderful place to come. If you get deterred along the way, come back to COS. But you'll be in places where not everybody's thinking the same thing that you are. But there are first-year medical students already thinking about missions and ophthalmology. There are residents. It's a wonderful, exciting place. But as you go along your journey, remember from 2 Corinthians 9, God is able to bless you abundantly, so that in all things, at all times, having all that you need, you will abound in every good work. It's very fast today. Thank you guys for listening. I'm not an expert in missions, but Brad's got something to say.
I don't know what God does. I know who he is, and he's whispering. He does not shout, he whispers. And he's tugging on people right now after what Peter said, to get out of your comfort zone, to risk everything for him. Did he not risk it all for you? Peter, I am so grateful that you came to me, and when we were talking about working with the hospitals, you said one thing that really alleviated my fears of working with hospitals. You said, I know, Emily, and I know you're praying about your decisions. Do nothing without prayer. I mean, Peter, what you're doing, we still doesn't make sense. And is a business sense for somebody to go for 8 months? Can you even fathom how we started this process?
Just a backstory there. As we were pondering going, this is the second year that we've gone, stepped away from U.S. practice to serve overseas. So we were pondering the first time. I kept coming over to Brad as a mentor, somebody who's been before me, who has done missions himself, leaving his practice when it was much smaller and seemed much more daunting, and saying, does this make sense? Is this worth it? And Brad is excellent at pointing at what is most important, thinking about our family, thinking about our faith, and career further down the line. But eventually I had to come back to Brad and say, you know what, I'm not just asking for advice, I'm asking for a job. And he was gracious enough to say, well, I don't know, but yes. and that type of mentality is just totally relying on the Lord. And who Brad is up on the stage is who he is in the office as well. Just lifting up big, worldly practice decisions up to God and say, what do we do? Where do we go from here? And that's part of what I'm trying to convey in my thoughts about a Christian practice. There are many ways you can serve, many places you can serve. But some of the things we're trying to think about with the practice and how to serve a community, how to do some bigger things, really takes everybody being on the same page.